So I'm Dr. Van Tonder from the Hope Fertility and Endometriosis Clinic. We're the newest unit in the country doing infertility treatments. I just want to thank the organizing committee for asking me to do a talk on general surrogacy. So what I'm going to talk about is firstly the definition of surrogacy, factors determining the perfect surrogate for you and the journey, types of surrogacy, a brief history of surrogacy, the surrogacy law in South Africa. I'm not going to say much about because there is a speaker after me that's going to enlighten you about the legal aspects. Timelines of the surrogacy process, the responsibility of the reproductive medicine specialists towards the surrogate, the costs associated with surrogacy, with the surrogacy process. So the definition of surrogacy is a surrogate is a woman, the surrogate mother, who carries the baby on behalf of the future parent or parents, referred to as the commissioning party or parties, who are medically unable to do so. So the factors determining the perfect surrogate for your journey is to create an optimal atmosphere with the highest chances of having a healthy delivery of a baby without complications. A surrogate woman should be within her primary childbearing years. So choosing a surrogate, there are certain requirements. The requirements normally, the age of the patient is between 21 and 42 years of age. Dr. Biko told you why, partially why 42 years of age. Also after 42 years of age, patients have more medical conditions that doesn't make them fit surrogates. And then their BMI must be less than 35. Personally, I think even 35 is very high because we know that with the higher your BMI, the bigger the chances of a miscarriage. And then she must have had a successful pregnancy herself, plus she must have her own living child. And then she mustn't have had more than 2 previous cesarean sections. So the types of surrogates, you get 2 types, namely traditional and gestational surrogacy. So in traditional surrogacy, the surrogate's eggs are used, making her the biological mother of the child she carries. We call her then the surrogate mother. We prefer not to do this type of surrogacies because it has a lot of implications legally, which I think Robin Friedman will discuss later on. And then gestational surrogacy is the most common one that we do nowadays. Is the surrogate has no biological link to the baby. Donor eggs are fertilized and transferred back into the surrogate. And then also sometimes we use donor sperm. And we call her then the gestational carrier. So she's just carrying the baby up till birth. While this distinction may be simple, it has several implications that prospective intended parents should take into consideration when comparing traditional versus gestational surrogacy. Then a brief history of surrogacy. Surrogacy already comes from the biblical times. There they usually used traditional surrogacy because there were no ART at that stage. And if you want to, you can go and read in the Bible in Genesis 16 about one of the first types of surrogacy that was done. Then traditional surrogacy was practiced in the Bible as an ancient practice, and then traditional surrogacy was also practiced in ancient Rome. Surrogacy law, I'm not going to say much about it, but basically is regulated by Chapter 19 of the Children's Act, 38 of 2005. An important aspect of statutory compliance with the Children's Act is that all parties will need to conclude a written agreement with each other prior to embarking on the process of surrogacy. This agreement must be confirmed by the High Court and be made an order of the court. And this is very important, prior to the surrogate being inseminated or embryos transferred. This process is a must and be undertaken by an advocate who specializes in family law. Okay, in fertile women, main indicators for surrogacy. There are a lot of medical jargon here, but the main ones is certain medical conditions. Some women that received oncology treatment, patients with recurrent implantation failures, and then patients that have lost their uteruses due, it could be congenital or it could be because of things like fibroid uteruses or severe adenomyosis, which is endometriosis of the wall of the uterus. Then the timelines for surrogacy process. It's basically the legal process, and the legal process can take some time because you need to get a court date, you need to see the surrogacy advocate, you need to do the consents, so it takes a long time. The other thing is the timeline to get a surrogate. Sometimes you are lucky, you can get a surrogate within a week. And these surrogates could be a family member. So that's the easiest, but to get a surrogate sometimes take a long time. And you have to advertise or go through a surrogacy agency, or you have to get a surrogate from your treating physician, etc. And then the screening process of the surrogate by the reproductive medicine specialist also takes some time. There's medical assessment that needs to be done. And then the patient or the surrogate needs to be referred to a psychologist for a full psychological evaluation. And then also comes the IVF process, because these the gamete or the embryo needs to be transferred into, and we sometimes need to get eggs, or we need to get sperm, we need to make an embryo. That all takes time. So finding a surrogate can take 1 week up to 1 year, and the entire process from the beginning can take up to 1.5 years. Then the responsibilities, and this lies very close to my heart, the responsibilities of a reproductive medicine specialist towards the surrogate. These people do this selfless. Commercial surrogacy is not allowed in South Africa. So these patients do it to give people a chance to have a baby. So treat the surrogate with absolute dignity, respect, and understanding. And then we must obtain a comprehensive history, do a physical examination. We have to do blood tests, and we have to refer the patient to an eligible psychologist for comprehensive evaluation. And then you must discuss the results of the medical evaluation with the surrogate. She must know what's going on, what's happening. Is she healthy? Discuss the fertility process with her and develop a trust relationship with the surrogate. That's very important because you are going to manage falling pregnant, and there needs to be a trust relationship. Now, the costs associated with the surrogacy process, I found many different cost analysis, but the IVF medical costs could be anything between 70 to 215,000 rands. The screening costs of the surrogate could be anything between 17 and 25,000 rands. The legal costs can be between 60 and 85,000 rands. And the monthly costs, now people will ask me what monthly costs. The monthly costs that are paid to the surrogate is usually loss of income, the transport fees to the IVF unit, and things like medical aid. You have to put on a medical aid, etc. All these costs above are dependent on the agreement which is signed between the surrogate and the commissioning couple. I want to thank you. I also want to thank my two colleagues, Dr. Pillay and Dr. McLachlan, to select me to do this talk because they know it lies very close to my heart. I just want to thank them, and I want to thank also all the donors and the surrogates that are prepared to help childless couples. Thank you very much.